veins, the posterior vena cava is between the kidneys. So look for something blue between the kidneys. I've spread apart some of the areas. These are the two kidneys, and the blue on or in between them is a posterior vena cava, and it's formed mostly from blood vessels coming in from the side, draining the kidneys and the gonads. These are all urogenital arteries. Veins, sorry about that, veins. These are urogenital veins feeding into that. The hepatic portal system is what brings blood from the gut to the liver. So we're looking up here for this one, and looks like our hepatic portal vein is right in here. It's got quite a bit of fat around. That's not unusual. And it's not always injected the easiest, but you can generally see enough to get the key elements. That's the hepatic portal vein. And it's formed by union of a number of veins coming from the stomach. These are all gastric veins. There may be one or a number of them. Anything from the stomach is going to be gastric vein. Likewise, anything from the small intestine will be intestinals. So this is an intestinal vein because it's coming from the small intestine, or you can see some of the blue actually in the membrane in the mesentery of the small intestine here. That leaves the last set of veins more or less with the renal portal area. And these include these renal portal veins here bringing blood to the kidneys.
Those are on the outside of the kidneys.
They're on the outside edge, the lateral edge of the kidneys. They are fed in part by, there is a, you may have to help me, dorsal lumbar vein. Is that one of them on your list? Dorsal lumbar vein. It would have been,
list,
yeah, connected right here.
Well, my list is right there. You can look at it.
Okay. And then also blood coming from back here. This deep blue one here is sciatic vein, and more from the outside of the thigh is femoral vein. So this is femoral vein wrapped all the way on around. This is a nice big femoral vein all the way around here. And usually we can see sciatic vein in here too, but it may be deep on this. The blue that we see deep in there, where the tip of my pointer is at, is sciatic vein. That's another view of sciatic vein. So you've got sciatic artery, vein, and nerve all kind of right in together there.
So how can you tell the difference between femoral and sciatic?
Sciatic vein will be deep. Femoral vein, you're going to be looking for something more superficial. It's going to be on the outside edge. It's going to be just underneath this tensor fascia lata muscle that's been ripped away on here. If you saw something down in here where you could easily trace it back to its superficial, it's not coming from down deep. Sciatic is going to be deep. Femoral is more superficial. It's like that on us too. And then last couple of ones, these are pelvic veins here and here. They unite to form the ventral abdominal vein, which looks like it's been torn in this one, but it looks like that was part of it. I'm not sure where the rest of it went to. Here, probably ventral abdominal vein right here.
Is that like the one that sticks out when you first open it?
Yes, when it's right on top of all the viscera, the gonads, and the digestive organ. I think that's it.